For residents in Homa Bay, for years, cancer patients in Homa Bay County have had to travel to neighboring counties in search of specialized care. That is now set to change following the commissioning of the Phoebe Asio Oncology Center at Homa Bay County Teaching and Referral Hospital. The facility will provide local diagnosis, chemotherapy and palliative care, bringing critical services closer to patients. Here's Elizabeth Atieno with a report on that.
Every week, more than 15 cancer patients are referred from Homa Bay County Referral Hospital to neighboring counties such as Kisumu and Eldoret for treatment and management of the disease.
In Homa Bay County as a whole, I don't think we have any cancer center. And in fact, speaking here, even up to now, I've not changed my treatment point. I always go to Nairobi for my reviews and everything. And I'm only imagining that I'm managing it because maybe I'm a teacher.
For years, Homa Bay County Referral Hospital has only been performing CT scans to determine the stage of cancer before referring patients to better equipped facilities outside the county.
So at the moment we refer up to 20 patients in a week. And even when we say 20, that is a modest number because the reality is that there are other patients who self-refer from other facilities within the county.
The referral of patients for diagnosis and treatment has led to late diagnosis in Homa Bay, thereby affecting treatment outcomes.
And then we also find that some cannot even find fare to the place. In fact, at the moment, we even have one of us who started treatment recently, and she even called me because we normally have our meetings to talk to members to help her get transport to Kisumu, not even in Eldoret.
In a bid to address this, the Homa Bay County government, in partnership with the Aga Khan Foundation, has established the Phoebe Asio Oncology Center at Homa Bay County Referral Hospital. The facility is aimed at serving more than 40 cancer patients daily as part of efforts to bring cancer services closer to the people.
This conversation about having a facility to treat our people who have cancer here in Homa Bay without them having to leave to go to distant places to receive the service. It is a conversation that we had from day one.
Of these, we have a mix of patients cutting across cervical cancer, breast cancer, and prostate cancer. So what we envision is that we are going to ensure that all patients within this number that require treatment, they will be able to receive treatment from within this facility.
Other than cancer screening, which we are focusing largely on cervical and breast cancers, we also supporting HPV vaccination in this region.
Treatment and transport costs have placed additional pressure on families already struggling to make ends meet. In a bid to address this, a group of women living with cancer in Homa Bay County has established a savings scheme to help meet the cost of treatment and other medical expenses.
We normally meet after every 3 months. So in our meetings, we do encourage ourselves, we share a lot, our experiences, and at times we would even changa something small and help others in one way or another.
Health stakeholders in Homa Bay County are now calling for increased public awareness, an end to harmful myths and stigma, and greater investment in cancer screening and treatment services, especially in rural communities, to help prevent further loss of lives. Elizabeth Atieno, TV 47.